So qualified Medicare beneficiary is someone whose income is at or below the federal poverty level, also known as FPL. So Medicare says that anyone whose income is at 100% of the FPL is considered, well, the FPL is the federal poverty level. So anyone whose income is below that amount is considered poor. Now, someone that's QMB, they have prescription copays of $1.60 or $4.80 per brand. That means that they're already enrolled in LIS. Okay, so if you're talking to someone and you say, you know, how much you pay for prescriptions? Oh, $1.60 or $4. Right there, it means okay, this person is eligible for Medicaid more than likely. And okay, now I'm going to transition. I'm going to offer them a D-SNP plan, and you know, instead of offering a regular Medicare Advantage plan. Now, if someone is enrolled in Medicaid, then you know they don't pay for anything, you know, for the medical. And so their medical coverage is covered. So Medicare covers 80%. They're enrolled in Medicaid. Medicaid is going to cover the remaining 20%. So they're not paying co-pays. They're not paying co-insurance for any medical services that they receive. If they have prescription co-pays, they'll pay $1.60 or $4.80. Now, Freedom to Work program. That's someone that's eligible, that's disabled. Between the ages of 16 and 64, they can apply for the Freedom to Work program. They're eligible for Medicaid benefits, and they're also eligible to enroll into a dual special needs plan. We have a lot of folks that want to work, but unfortunately, because they're disabled, they're not able to work, and they feel that if they work, they're going to lose eligibility. They can apply for the Freedom to Work program. They don't have to earn that much money. The only thing is that they have to work someplace. They cannot be like a 1099. They cannot be self-employed. They have to work somewhere. So a lot of folks apply for the Freedom to Work program and work 4 hours or 5 hours just to make sure that their income is below the standard. If someone's enrolled in the Freedom to Work program, their Social Security benefits are not counted as countable earned income. The only thing that's counted is the amount that they earn, their earned income. That's what's counted. And they're able to enroll, like I mentioned, into a dual special needs. A lot of agents miss this opportunity, right? Now, who's not eligible to enroll into a dual special needs plan is those individuals who are considered SLMB. So if their income is between $1,305 to $1,565, or they're married and their income is $1,763 to $2,115, they're not eligible to enroll into a D-SNP plan. So if you call, you say, hey, I want to know if my member is enrolled in Medicaid, or if they're, we're going to say yes, they are. If they're not enrolled in Medicaid, we're going to tell you they're SLMB. Someone that's SLMB has a prescription copay of $4.90 up to $12.15 per brand. A lot of agents will use some systems that some of our competitors have to verify eligibility. And a lot of times, someone may have a level 1 LIS, and sometimes agents tend to think, oh, they're not eligible for Medicaid, and they automatically enroll them into a Medicare Advantage plan. And then another broker comes in and does the proper needs analysis and says, hey, well, what's your income? Oh, it's $1,100. Oh, okay. I'm going to call just to verify eligibility. Because once again, they check that their income is under the income limit for Q. So the QMB income limit is, yes. They can call us to verify the carrier. Yeah, we can verify eligibility. And then that way you're able to, if you call in, let's say you're meeting with somebody, you do the needs analysis and say, well, I looked the system up, and the tool that let's say whatever carrier has, some of the carriers have tools to verify eligibility, but they're not always. I always tell folks, ask them what their income is. If they tell you their income is $1,200, that's an indicator. You know what, their LIS level may be different, but they are eligible for Medicaid. People can be working or they gain additional income, and they may have a different LIS level. And so at that point, now you're able to enroll them into a dual. But this is something that's really important. Now, if someone is QI1, qualified individual, this is the highest income limit for these. Someone that's SLMB or QI1, they're enrolled in the Medicare Savings Program, in which the state is paying their Part B premium on their behalf. So they don't have a deduction for Medicare, but they're not eligible for medical assistance. The only additional benefit that they get is assistance with their prescription, since they're automatically enrolled in LIS. And once again, they will have the same copays as level 1. Any additional questions on SLMB or QI1?
You said
No. 16. Yeah, so for the Freedom to Work program, it's 16 to 64. Once the beneficiary turns 65, and it breaks your heart, because sometimes, why am I losing my Medicaid benefits? Well, you're turned 65. and it's, you know, unfortunately there's folks that rely on the Freedom to Work program. They're, you know, a lot of them are doing maybe 4 hours, you know, per day, you know, 20 hours, or even some are doing even less, but they cannot be